Right,
आप
sir.
छोड़ दो उसको,
लोकेशन
क्या कह रहे हैं,
लोकेशन
भेज दो ना.
A very good afternoon to all. Welcome to the webinar exploring the latest in cardiac sciences, including advancements in TAVR, cutting-edge mechanical circulatory support devices, and enhanced imaging techniques for coronary interventions. The topic for today is what's new in cardiac science. And to address the topic, we have with us none other than yes, sir. So it's a pleasure for me to welcome sir to our platform. None other than Padma Shri Dr. Mohsin Wali sir. Sir has MD, FSCC, FRCP, FICP, MRCP, FIMSA, FGS1, FIAMS, FIACM. He is a senior consultant of at Sir Gangaram Hospital at New Delhi. So with this introduction, now I would request sir to please start with the topic for today. Over to you, sir.
Thank you, Arpita. I'm here to just refresh my knowledge of day-to-day what we are doing and what India is progressing. And there's a lot of things which have happened in the past, and we are being benefited with that. So, according to the WHO, diseases such as stroke and ischemic heart disease roughly account for 17.7 million deaths. And this number includes a large set of younger population. COVID-19 pandemic is acting as a trigger, as the virus alone can be a cause of heart attack. We are seeing so many sudden death cases. The World Heart Federation observes September 29 every year as World Heart Day. This year, the objective for World Heart Day is globally harnessing the power of digital health to improve awareness, prevention, and management of CVD. The cardiac care has witnessed a significant transformation over the last decade, with artificial intelligence and the machine learning playing an important role. Cardiologists and cardiac surgeons are bringing unprecedented revolutions in cardiac treatment and mechanisms. These technological advancements are facilitating early detection and treatment of critically ill patients through improving outcomes. So we are dealing this heart. On one side is the robot, and in the center is the connection worldwide, and at the top of physician's healing hand. So all this combined is giving us a lot of good results, and we are making patient-specific 3D models, and this is a graphic representation of a 3D model which we can create. So 3D model of the heart can aid a doctor in understanding the nature of the heart disease. Scientists at University College of London have developed such 3D printed models from MRI scans of children born with heart defects, that is the congenital heart diseases. These models can also boost patients and their families' understanding of the heart condition. The same team is also working to produce computer simulations to help the surgeon planning surgery for such children. This personalized approach in cardiac care will help surgeons and patients decide the best treatment modalities. 25. Like what is happening at the level of skin for vis-a-vis stroke. A simple skin patch may help in improving the survival chances of stroke victims. And see this patch has a lot of information derived from the patient. Unbelievable, but true. Researchers are studying at the University of Nottingham. They are working on a skin patch that can be applied in an ambulance when the patient is being transported. Immediately after patient suffers a suspected stroke attack, and this patch, which delivers the drug glyceryl trinitrate, can widen the blood vessels and is harmless. and lower the blood pressure, thereby reducing the potential damage caused by the stroke. By starting treatment within an hour, I would say within 20 minutes, an hour of the stroke could revolutionize the stroke care. Treating patients inside the ambulances on the way to the hospital will save vital time and aid recovery. Scientists are hoping if this patch is safe to use, it can be used by paramedics, by the nurses, and what? Yeah, patch is only on the during transfer, and this would give information also to the hospital what's happening, like a rough tracing of the ECG, and deliver the nitroglycerin. So scientists are hoping if this patch is safe to use, it can be used by paramedics, that the nurses, that the ambulance staff, where conventional treatment facility are available. So this patch is applied while patient is being transported. Similarly, implantable heart device in the heart failure patients, they may experience irregularity in the heart rhythm. It can be too slow, too fast, or irregular. Presently, we are using ECG recording to trace an irregularity in the heart rhythm. ECG can give you a picture of that moment only, but what if a doctor wants to track rhythm over a longer period to have better understanding of the patient's health? So researchers are working on implantable cardiac monitors. And these are working already. We are working on that. And these are tiny devices that can be implanted under the skin for recording cardiac rhythm. We have made them further smaller. They are subcutaneous and they are connected somehow by the wireless leads. So they pick up the cardiac rhythm and they're very handy. They can be implanted by less trained cardiologists who are doing this work. And this is a unique area on which we are working. And they will come when we will be placing them like a Holter monitor and see what's happening to the heart. Similarly, the patients who have got statins use, that is the lipid problems, and we know by now that the disorders of the lipids, when we know them, they are already very late. So fatty deposits in the blood vessels are one of the most common causes of the various cardiovascular diseases. Though statins can help to lower the levels of LDL in the blood, they can affect other tissues like muscles, making some people intolerant to statins. On the other hand, they have pleomorphic effects. Scientists are working on nanomaterials. These nanomaterials can deliver cholesterol-loading drugs exactly to the sites where they are needed most. Nanomaterials are incredibly small but have very high stability, and they biodegrade on their own once the drugs have been delivered to the specific site. So this is a very great advancement to attack the plaque, within the coronary artery. So this is a graphic representation of how nanomaterials for cholesterol sensing. There are carbon dots. This is graphene. This is the new substance on which a lot of research is going on. CNT, and these are the polymers like chitosan and metal nanoparticles, basically silver, which is harmless to the body, then metal oxide nanoparticles. So these are combine a huge scope for research. Now, artificial intelligence will dominate the future of the medical care, and through machine learning and deep learning, combined with telemedicine and mobile health, natural language processing, Internet of Things, AI-powered platforms, and wearable devices like I'm wearing today. This device is not a health watch, but this device is giving my data of sleep, my heartbeat during sleep, my ocular movements during sleep, it senses, and my sleep quality, my mood, it sends it, apart from the heart rate and blood pressure. So these devices are already there. And we are making a twin program popular here recently, and that is studying our whole body's data, including our diet on day-to-day basis. The doctor is deputed. The dietitian is debuted on a day-to-day basis, and we are seeing the good results. So cardiology, heart failure, sorry for the spelling, it is heart failure. And we have to fill the current gaps by tailored medicine. This is an important word in today's medicine, that everybody is not same. You know, you can't close the eye and give 80 milligram of rosuvastatin to each patient. You have to see the requirement. And early detection, predictive modeling, remote monitoring, inter integration of data and research reorganization. I'll give you an example of early detection. What are we doing for lipoprotein A? We are monitoring lipoprotein A. Lipoprotein A at the age of 35, 40, when somebody is showing first heart attack, or somebody is having increased cholesterol levels. It is very late. It is very late. It should be done at the time of college going. Or in future, I will be recommending it when I will not be alive, at the time of passing it class. So, like we see various parameters when the students takes admission in the college, we should also see his lipid profile. That time it could be beneficial for the patient. We are diagnosing it very late, like doing a pregnancy test in labor room. This is not early detection. Now, basics. Let us start with the basics. Artificial intelligence is ability of the machine to solve the very complex, to solve the complex problem that would otherwise require human intervention. Advances in technology have made it possible for the machines to accurately and quickly analyze data and the large amount of data. And this learning improves decision making, accurate diagnosis, and proper treatment planning by detecting specific patterns in the patient data. Cardiovascular doctors and scientists today are now combining artificial intelligence with clinical practice for better care. Here are two examples of how doctors are using AI for better outcomes for people with stroke and preventing heart problem. Computer is trained to analyze CT data, can examine the scan, diagnose the stroke, and thus saving valuable time. We are doing now as a pooled observation, and one doctor can make the reports of 10 centers in a day. Similarly, applying AI to ECGs can be used to detect any abnormality of the heart pump which is left untreated and can lead to heart failure. So this is what we can do in a big lab. First, see this image, 4 seats in 4 corners and a monitoring console. And now this is signal processing. You get the signal, you process the signal, you stratify the clinical risk, the natural language processing, and whatever you are learning from distance in a different language, you process it, image process, and fundamental clinical discovery like genetics. So apply all together. This will be the model of the care for the future, that various platforms are working, analyzing, interpreting, and guiding the doctors to implement the treatment. They don't have to see, this is a case of heart attack which is being managed through the robotic lab, advanced AI lab combined, and the signals and instructions will directly go to the cath lab staff, and they will attempt coronary intervention. I will give you an example. Like there is a heart calcified clot. In angiography, you cannot see it unless you do intravascular ultrasound. But this system will analyze that clot. It will tell you not to put this there, but to do a different method, blood ablation. So these decisions will be made by the machine tomorrow, which we are making today by the intravascular ultrasound. And one of the latest advancements in the cardiac surgery, which I am proud to say in my hospital, they are using robot-assisted surgery, allows the surgeons to perform accurate, complex surgeries with greater precision and accuracy, resulting in the less blood loss, less failure to properly know that whatever they are suturing together is being done properly. They can have access to the difficult planes when they are suturing. They are combining, they are anastomosing the faster recovery times because there is no trauma, less trauma, and reduced scarring. A robot-assisted CABT, for example, is a highly advanced procedure in which a robot is used to aid the surgeon in performing a bypass graft surgery of the heart. So this is a model of the robot which is part of the operation theater. And of course, surgeon monitors this, but the accuracy is supreme. So here is the surgeon instead of at the table. So surgeon's position is changed and the rest operation is done by the robotic arms. It has 12 arms and it performs the CABT very accurately. It knows where to make the incision, how to make the incision, how much to retract, how much retraction will lead to rib fracture. All the data will be combined through artificial intelligence in this robot, and there will be precision surgery, and it will be monitored by the surgeon under the vision. Now, recently we have started trans-aortic valve replacement. It is a transcatheter aortic valve replacement, which is already in functioning in various hospitals. Recent addition to this is mitral valve repair. This involves making a smaller incision and using specialized equipment to access the affected area. These procedures have many benefits over the traditional open heart surgery and lesser mortality, including shorter hospital stay, faster recovery. I just got a journal showing Alain Kreiber, and he is the father of this kind of TAVI interventions. And I was the first doctor from India who watched the video when he performed first trans-aortic valve replacement. And he sent me his picture, he sent me his video, and he sent me the picture of cath lab. And I showed it to RML Hospital when this TAVI word was not known in India. And I salute to him. He recently died. And this is how the procedure is done. This is trans-aortic valve replacement. Of course, we have innovated this further. When in his last days, he developed transjugular valve replacement, and and more progress will follow. Then there is a mitral valve clip, which repairs the leaking valve, and this also helps in reducing surgical damage to the heart, and the amount of regurgitation can be digitally controlled, and results are guaranteed. And here is a glimpse of that, how the clip works. And this is what is being done at some centers, started in one of the hospitals in Delhi. Then advancement for the congenital heart disease. The surgical technique and technology, many congenital heart disease can now be repaired with minimally invasive approaches. You remember in the previous days, we used to have 4-stage operation of the Felix tetralogy. But now it can be done even in the newborn, and choosing the correct approach depends on several factors, including the type and severity of the defect, as well as the age and overall health of the patient. So more and more we are progressing. Every day we are getting up with minimal invasive surgeries, with less damage to the heart, saving time, saving the days to stay in the hospital, and ultimately heart transplant is just going to be easy as we are doing regular liver transplants, provided we have donors, we have availability, we have transport. So I think these are the things which we have progressed. I have shown one device, and now I have shown this implantable pacemaker, pulse generator. This is again with minimal invasive surgery. We have radio frequency ablation, coronary angioplasty, stent placement, and recently transjugular intrahepatic portosystemic shunt, that is TIPS, is being done, and recent advances in coronary interventions. So just to sum up, which you may be knowing, now coronary angioplasty is a routine procedure, but now we are knowing how much wrong we were doing. At least 70% stents were placed wrongly, and this is what cardiologists say. So we have transjugular intrahepatic portosystemic shunt is the talk. And this also is being covered in this topic because cardiologists are involved. And we have got certain procedures like interventional radiology, invasive diagnosis, interventional cardiology. This slide I have borrowed from one of my colleagues with his permission. And this is all what we are doing today. And there is so much to be talked, but I think the robotics, artificial intelligence, and minimal invasive surgeries are the future of tomorrow's cardiology. And that is what WHO also is pointing out. And I salute all the researchers, all the people, all the engineers from who are part of the team and assisting us. And the newer generation of doctors, which is growing in this era, would be performing more and more of latest interventions. I have a colleague of mine, I have a class fellow of mine. Were talking about science of mitral stenosis when we were students of MD. Now his son is doing mitral valve clip. So this is when I met both of them together, the father and son. I told both of them that like my generation was doing and then seeing mitral valve what means, manual mitral valve what means, your generation is doing TAVI. So this is what is a great change in 30 years, 35 years, that a father and son are doing different things. Both are practicing same medicine, but with absolutely different cardiology. So this is the beauty of recent advancements. And I wish for tomorrow our budding doctors who are who are world's best doctors, second to none, they will take the cardiology to the whole world in a very bright way. And I wish them all success. Thank you very much.
Thank you, sir. Thank you so much for your beautiful talk. Sir, can I now move on to the question answer round?
Well, you can.
Yes, sir. Thank you so much, sir. So we have received a few questions from our viewers. How has remote monitoring impacted the management of chronic heart failure?
Yes, remote monitoring is very important. See, patients' compliance is more important in heart failure. And very few patients are compliant. You see, every day I get 2 patients out of 30 who say, "Saab, पेशाब बहुत आ रहा था, हमने ये वाली दवाई बंद कर दी," and they come in frank failure. So remote monitoring is very important and it should be practiced. We can also monitor at the same time 3 days holters, long duration holter, and also the remote monitoring with a sensor which gives us data about the other parameters is very important because heart failure is not a disease which comes and goes. It develops over the weeks, over the months. So remote monitoring is very important.
So another question is, what are the latest recommendations for the use of SGLT2 inhibitors in heart failure with reduced ejection fraction?
Heart failure with reduced ejection fraction, glyphosins are hero. Most of us are using them, and in very many MACE trials, they have shown very promising results. And dapagliflozin is used in low dosage in India. It is used in very high dosage in abroad. The only risk with the use of these glyphosins is their ability to lose glucose in the urine, and most of the Indian patients have to be told to be careful, and doctors have to be careful for septicemia, urinary infections, the other complications which were mentioned at the time when they were launched, like gangrene of the scrotum, amputation of the leg. They have been proved very minuscule. So we are using them even in not. The beauty is we are using them in non-diabetic patients, and they are safely being used. And also they are renoprotective, they are cardioprotective, and we have been seeing every day the ejection fractions rising. And this is very, very encouraging with sacubitril, valsartan, combining them with low dose of beta blockers and SGLT2, dapagliflozin. This gives fantastic results, and they are the talk of every conference of cardiology here and abroad, and the future is bright.
Right, sir. Right, sir. Another question is, what are the major considerations when choosing between direct oral anticoagulants and warfarin in atrial fibrillation patients?
Well, this a lot of work has been done recently on these anticoagulants, and I would say it took 8 years for dabigatran, which has come last month as FDA has approved. And this is regarded as safe. But the individual patient is, I was talking here, tailor-made treatment. See, every patient is different. Somebody bleeds at 2 milligram level of acetron. Somebody tolerates 6 milligrams very well. So, knowing their use and the cost, especially in India, we have to choose these medications. And as per my latest information, only day before yesterday, dabigatran has been approved by FDA. So this is an addition to the list of them.
Thank you, sir. Last question for today. That is, how is artificial intelligence transforming cardiac imaging diagnostics?
I have told that first thing, which is already been practiced in many machines, are coming with AI helping ECG diagnosis. The other advantage is distance tracking of diagnosis. One center can control 20 centers by making accurate diagnosis. It can analyze complex lesions in coronary interventions, coronary angiography. Artificial intelligence can accurately tell us methods of intervention in complex congenital heart diseases. I have shown in some of the slides the use of artificial intelligence, how it can be used, how we can make a duplication of the model of the heart. If this is visible, you can see this is making a replica of the heart. And then the 3D models are made by artificial intelligence, and they can be controlled in a lab. I have shown that this one. So this is what artificial intelligence is doing. There may be remote centers attached to this big mega center, and they must be round the clock receiving information from ICUs, from the people traveling even in the aeroplane, and people traveling in the ambulances, people being treated in a village, remote village in ICU. It is going to revolutionize the medical care. This is wonderful, and not sitting in India, sitting in America, a doctor can guide the doctor sitting in a remote village in India. So this is the beauty of the data collection through the artificial intelligence. We can control and revive the model of the holistic care, which we always talk. Thank you.
Thank you, sir. Thank you so much. So these were all the queries for today. Sir, thank you for your expertise and insight. It has been invaluable in raising awareness about this topic, what's new in cardiac sciences. So thank you. And I would like to thank everyone who has been involved in making this program a successful one. Thank you to all the viewers for their active participation. So with that note, sir, I would like to conclude the session for today. Thank you so much for your time.